My name is André Machado. I am a neurosurgeon. I am the director of the Cleveland Clinic Center for Neurological Restoration. A few phase 1 clinical trials in deep brain stimulation for depression. The one that the Cleveland Clinic was involved in is a small clinical trial evaluating the safety and some of the efficacy of deep brain stimulation of a region known as the ventrostriatum and ventral capsular region in patients with treatment refractory depression. I can tell you that there is a multi-center clinical trial that's ongoing in deep brain stimulation of this same region for patients with treatment refractory depression. I know of 2 companies that are conducting clinical trials in this area. One is Medtronic, which is the sponsor for the clinical trial that I was telling you about of deep brain stimulation in the ventrostriatum and ventral capsular region. There is another company, St. Jude, that also has a clinical trial, to my knowledge, in deep brain stimulation for depression, although we are not involved in that study. So if it's going to work or not, that's going to be decided and learned with the ongoing clinical trials that we're performing, right? We only have preliminary information. If we knew for a fact we wouldn't have to perform these large studies, we will know more in the next few years as we complete these studies. From the preliminary indications that we had, the therapy seems to be safe and seems to be effective in improving depression in patients who were very severe and patients who had failed pretty much everything that there is currently available for depression, including several medications that were attempted, combinations of medications, as well as, in most cases, electroconvulsive therapy. Especially when you're considering medical devices, for it to be a viable therapy so that the hospital is not losing an extraordinary amount of money by treating the patients. The reimbursement level will depend largely on the cost of the devices. To my understanding, the hospitals are paid per case, which involves the admission, the surgical treatment, post-operative management, and then there's a global period that follows that. The cost of the implant is also included in that. So if the implant is very, very expensive, and the reimbursement is equal or marginally above the cost of that implant, you already know that you are not going to be able to break even in each procedure. So in order to know what would be the level of reimbursement that would make this a feasible therapy, we would first have to know what will be the cost of the device for this specific indication, and we don't know that yet.